Do you have nerve pain, numbness, and tingling traveling in the arms and hands, especially the thumb area? In today's video, I'm going to teach you how to glide and floss the radial nerve in your arms to release neurotension in 2 easy progressive steps. Coming up. What's cracking, guys? It's Dr. Nevel, aka Dr. Ginger Ninja. And on this channel, we show chiropractic and physical therapy demonstrations and explain how-to videos just like this one to get you out of pain and back in the game. If you're new here to the channel, consider subscribing and drop me a comment if you have any questions along the way. With that being said, let's floss like a boss. Radial nerve adhesions and compression can be caused by a variety of injuries or just repetitive motions. Think of nerves as strings that come out of our necks and travel down the arms. These strings can get gummed up in the soft tissue, creating symptoms such as numbness, tingling, or burning. While the adhesions and compressions can be caused by a variety of injury, the key is getting the nerves freed up and moving again. I find that nerve gliding works best when there are myofascial adhesions and scar tissue involved, but beware. Most people overdo nerve gliding and irritate the nerves, so start with just 5 to 10 reps and back off if you're feeling a lot of nerve tingling or numbness. To make it easy, I've broken the radial nerve glides into 2 progressive steps. Step 1. Start by tucking your thumb in and making a fist with your affected arm by your side. Flex your wrist and internally rotate your arm. Then raise your arm out to the side and slightly back with your wrist flexed until you start to feel tension. Once you feel tension, don't go any further. Then you can externally rotate your arm and bring your wrist back to a neutral position. From here, go back and forth, slowly flexing the wrist and internally rotating the arm, and then bring it back to neutral with your palm facing forward. You can use the other hand to make sure that your shoulder stays drawn and back the whole time, and make sure it doesn't get hiked up. Again, make sure you don't overdo it in the beginning. Step 2. So for step 2, we're going to do the same movement as step 1, but we're going to add head movement to it. So go ahead and grab your thumb and make a fist and flex the wrist. Then internally rotate and bring your arm out until you feel the same stretch. From here, laterally bend your head away from the affected arm while you uncoil the arm, bringing it back to neutral. Then bring your head back to center as you internally rotate the arm and flex the wrist. Again, make sure your shoulder stays in good posture with it retracted and depressed. Continue flossing back and forth for about 5 to 10 reps. Now remember, the radial nerve is one of 3 nerves that travel into the lower arm that can benefit from nerve flossing. So to get the most benefit, check out these 2 videos to learn how to floss the median and ulnar nerves. And if you got value today, punch that like button, subscribe, and we'll see you in the next video.